the direct bonding of lingual 2D brackets. This is a movie that describes an easy and simple method to directly bond 2D lingual brackets on the teeth of the lower arch. The material needed is the same as for labial bonding, with some minor modifications and according to the clinician preferences. Specifically, a regular tweezer, probe, scaler, the lingual spatula from Forestadent to open and close the wings of 2D lingual brackets, intraoral mirror, self-etching primer, the special Bollé gauge from Forestadent to get precise height measurements, and cotton rolls. It is recommended to hold the bracket in the same tweezer that you use in labial bonding, but in this specific way to make it easier to introduce it in the mouth of the patient with minimum interferences with the upper jaw. We start first by cleaning and pumicing the lingual side of the teeth to be bonded. Then we apply etching gel of 37% phosphoric acid according to et al. In 2008. The bond strength seems to be higher when the enamel is prepared with acid etch before the use of self-etching primers. Cleaning of the acid etch thoroughly with water spray. Isolation with cotton rolls. Air drying of the surfaces to be bonded. With the gauge, we mark the height for each bracket. Lower cuspids at 4.5 or 5 mm according to the clinical crown size. And we can find this is 4 mm. Lower incisors at 4 or 4.5 mm. The lead must be edge to edge with the stainless prong and the graduation starts at 1 mm. Self-etching primer application. Note here that this solution doesn't dilute and remove the marks of the pencil of the gauge. With a small amount of composite resin in the mesh of the bracket, we bond the first bracket, adjusting its position with the scaler in an indirect view using a mirror. Light curing for 5 seconds, twice occlusal and gingival with a lead unit. The first bracket in place. The same procedure and so on for the rest of the teeth. Special care must be done for the first bicuspid. The height of the bracket must be at the level of the labial part of the crestal edge. If the bracket is bigger than the lingual surface of the first bicuspid, the gap can be filled with composite. With a photocopy on an acetate paper of the lingual arch form template Forestadent, we can choose the specific arch form of the patient by superimposing it to the wire slot in the mouth of the patient. This is a shape 2 arch form. We choose a 0.010 shape 2 biolingual arch wire from Forestadent. We cut the excess length, marking the distal portion to be bent toward the teeth to avoid poking the tongue. Opening of the wings of the 2D lingual brackets with the lingual probe or spatula from Forestadent. Capping one prong of a weighing guard plier to avoid instrument slipping and to protect the labial enamel during the wire insertion and bracket closing. Insertion of the wire in as much as possible of slots. This is a simplified and easy technique for indirect bonding for lingual 2D brackets and can be applied in all simple cases. On the plaster model, we start first by drawing the long axis of all teeth. We start from buccal to lingual. On the molars and premolars, we mark the marginal crests. With the special lingual gauge from Forestadent, we mark the height of bracket position. On the lower incisors 4 mm, lower cuspids 4.5 mm, upper central incisors 4 mm, upper lateral incisors 3.5 mm, upper cuspids 4.5 mm, molars and premolars on the marginal edge. Make sure that the long axis is well marked and long enough under the gingival margin to keep it well visible after bracket placement. Now we pass for bracket placement on the plaster model. We have to hold the bracket with the tweezers in this specific way. We set the light to 10 seconds if it's a halogen, and 3 seconds if it is a high-intensity LED unit. We use regular composite that we usually use for buccal direct bonding. We place the bracket on the plaster model following the height line, and the long axis, the third wing of the bracket, facilitate the placement following the long axis. This is why we make long axis lines usually longer in this portion under the gingival margin. Using light for 10 seconds each. Molar tubes. We can use the same tubes as for buccal orthodontics. Thermoformed splint. We can use the same fold as for the bleaching. We cut the fold in a V shape around each hook. Sandblast all the brackets mesh to remove all residual composite and to improve bonding strength. We cut the splint into 3 pieces. Composite loading. Beware to spread a small quantity to avoid excess elimination after splint removal. Here we are using self-etching primers, or we can use regular 2 steps etching bonding. Self-etching on the teeth after their cleaning. Splint placement. We hold it in place firmly. We make sure that all brackets are in their right position. Light curing while holding the splint in place. Same for the anterior teeth. We choose arch form size on the Lingual arch template. Arch wire bending. We mark with a pen the bending location. We bend it more than one time and we pass it on the fire between two bands. Bend it again, then fire again till we get the final stable shape. Splint removal. We have to be cautious while removing the splint. This central incisor needs special treatment before bonding, so we chose to bond it directly. Wire placement. We try to engage it in as much as possible of brackets.